With an unusually quiet summer behind them, the fall just got more physical for these grade 9s.
It's really different in me. I haven't played lots of sports in a while, so it's really fun to be active again with my friends.
Don't bang that knee on the ground.
It's just as challenging for online gym teachers.
Come on, jumping jacks.
How do we teach sports skills while you're standing in your living room and you don't necessarily have another opponent or a partner to play a sport with?
Getting students moving again has taken on new urgency. A recent survey found about 5% of Canadian children met basic physical activity guidelines during the early part of the pandemic. For teens, it was less than 1%. Schools are now dealing with the consequences.
So physical educators have reported back to me that the physical activity levels have been alarming.
So alarming, Canada's largest school board has told gym teachers to cancel fall fitness testing.
They've noticed that kids are out of breath immediately. So the lack of physical activity that's taken place over the last 7 months is showing.
Some children have still managed to spend more active time outdoors than others. They usually live in less densely populated neighborhoods.
So in other words, living in a house like mine as opposed to a 40-story apartment building in a downtown city was a protective factor.
What you doing, eh?
This obesity researcher says he worries about the long-term impact of inactivity on children's health.
And I think there's some things that we can do about it, that the messaging of stay home, which we're starting to hear again with Wave 2, which is good messaging, but it doesn't mean stay inside.
So schools are trying to keep kids active outside for as long as they can. Vic Adopia, CBC News, Toronto.
Okay, now let me bring into the conversation infectious diseases specialist Dr. Zane Chagla, because Dr. Chagla, we've just watched two stories about the impact of the pandemic on mental health and on physical health when it comes to children. So what concerns you most about all of this?
Yeah, I think it's simply that. Children are social beings. They need individual and group activities for their development. And we're coming up with a lot of ideas on what not to do, whereas we're not giving kids the room to do things that are important. Using virtual means is fine, but we also don't want kids staring at screens all day for their ways of interacting. And so I think as a society and as public health officials, we need to message to kids on how they can meet appropriately, how they can socialize appropriately in person, and really focus on that mental well-being as part of the target on top of COVID prevention.
Okay, right. So help us navigate that, because the tricky part of all of this is that there is a real patchwork, right, out there about what's allowed, what isn't allowed. I know some sports leagues outside of school that are still running. So as a parent, how do I properly make a decision between something like, I don't know, hockey at an indoor rink, basketball at a playground versus something else altogether?
Yeah, I mean, the same principles apply. I think the schools do it in a way that is very risk averse, and rightfully so. The outdoor leagues and the indoor leagues, I think, are doing it as best as they can with guidelines. But remember, it's each individual's group's choice to follow the guidelines so that out of the law. We know things that are indoor, prolonged close contact are the highest risk, and especially when the masks are down. So those may be the activities you avoid. Things like outdoor tennis, outdoor running, or maybe the activities that you try to put your kids into in that sense. And then, just being careful about how they interact before and afterwards. Again, transmission can occur in the locker room and in the areas before and after the game. And so you really just want to go and then exit as normal.
Excellent points, all of them. Dr. Chagla, thanks so much for your time.
No problem. Take care.